Our media product, a teaser trailer for a psychological thriller called Side Effect, uses, develops and challenges the forms and conventions of real media products. I'll be comparing it with World War Z and Shutter Island, both psychological thrillers. We stuck to conventions of teaser trailers by keeping the length to a minimum, to ensure only a small part of the narrative was revealed. Teaser trailers are often 30 seconds to 1 minute long, and our trailer is 44 seconds. We chose to make our trailer this length to ensure the audience want to watch the film based on the content, therefore only important parts of the narrative need to be featured in a short space of time. Our trailer opens with the company Ident. We use Warner Brothers as it is a well-known conglomerate company which produces and distributes the film. World War Z opens with this, which then fades to black. We also done this to fit conventions. Our trailer fades into slow-paced shots of news reports, which gives a major clue to the narrative from the beginning. The shots then speed up to create a sense of panic throughout, suggesting a severe problem. This is also similar to World War Z, as the shots start slow-paced and then speed up when the problem occurs. Montage editing was used to fit conventions. Shutter Island used this, which doesn't give too much away about the narrative. This also intrigues the audience and gets them questioning as to what's going to happen next. The fact that it isn't chronological order also suggests this. The main characters are introduced almost straight away. Most teasers open with the main character, however we chose not to do this to give more sense of setting, as the Doctor was introduced to suggest a medical theme. In World War Z, the main character was introduced almost straight away to show significance throughout the film. In Shutter Island, the main character is also introduced after the establishing shot to show his importance. More characters are featured throughout our teaser trailer, and this is also shown in Shutter Island and World War Z, showing their role in the film. We chose to include titles to fit with conventions, as this is also used in World War Z and Shutter Island. In both these films, the titles are displayed in a white font on a black background. We chose to do this by featuring it in our trailer, and our title gives hints to the narratives, and we chose not to have a voiceover. This challenges the conventions, as usually trailer titles include actors and other work of directors, and so on. This is done to attract an audience who particularly like a certain actor or director. We chose not to include this to challenge the conventions, as we did not include well-known actors or directors, so the main focus of our trailer is the narrative, and our titles fit conventions as they have been carefully positioned in the trailer. For example, after the news report, the world's first is displayed. This is to get the audience questioning what the film is about. After the patient has been seen running along the corridor, another title is shown. This then hints as to why the patient might be acting in this way. 3 volunteers is shown before a shot of the 3 volunteers taking the tablet. This has been done to show who the 3 volunteers are and who are the main characters in the film. The title comes in at 37 seconds near the end of the trailer. This is to fit conventions, as the title is often shown near the end and can be seen in Shutter Island and World War Z. We chose to edit the title to fit with our brand and to establish a theme across the marketing campaign. The title is a newspaper font, suggesting how the theme is global news topic, and this also links to the beginning of our trailer, which is the news report. The white and blue font has been used to give a medical feel, and this is to fit the theme of an Ebola drug trial and the main setting being a hospital. Medical heartbeat or flatline also emphasises this. The name Side Effect links to the film, as it suggests there is some sort of consequence for the events that feature in the film. We edited the lighting of our trailer to give a cinematic effect. Although this was difficult due to the software and camera equipment, we tried to achieve a similar look to World War Z and Shutter Island. We also wanted the lighting to match the setting. Like Shutter Island had done with the dark setting, we wanted to achieve the opposite with the hospital setting. Other editing techniques we used, for example the use of slow motion, which could be seen in Shutter Island. They also used flashing lights between shots, and this could be seen in our trailer. We have done this to enhance the montage editing and fit with conventions of a trailer. We chose to use a soundtrack throughout the trailer, as this is commonly used in trailers such as World War Z. This is non-diegetic sound, which is labelled with diegetic sound. For example, dialogue.
I'm doing this for...
which helps to get to know the character. Foley sounds are also used to enhance the situation. For example, we recorded separate sound of footsteps to layer on the clip of the Doctor walking. World War Z also uses Foley sounds to enhance the situation, and it gives more dramatic emphasis on the sound. Non-diegetic sounds such as booms are used when the titles are introduced and in important parts of the trailer. This focuses on the importance of these parts and also fits with conventions of trailers. This can also be seen with the screech sound effect we used in our media product. We challenged conventions by not having a voiceover. We felt this would not fit or benefit our genre. We felt our narrative shows how the mental health of the patients deteriorates, and so having a voiceover and montage editing would interrupt the pace and the psychological theme of our trailer. Scene in World War Z. Although this would have set the scene and established where the film is set, we chose not to introduce this to keep the setting a secret, which would get the audience thinking. However, we did fit conventions by having a range of shots and angles, for example, long shots, mid shots, close-ups, extreme close-ups, and canted angle shots. This range of shots connotes the mental instability of the characters, linking to the psychological element of the film. A range of shots is also used in real media products, for example Shutter Island. We also took into consideration how we position the camera for some shots. For example, this shot shows each character taking the pill. This is slow-paced, showing the importance and how this leads to a series of devastating events. We also used a tracking shot to track the character in this shot. This was as effective as it enhanced the mental instability and relates to the genre. Real media products also use shots which fits the genre, for example in World War Z. We ensured the mise-en-scène fit conventions of psychological thrillers. For example, we made sure costume fit real medical settings, and we ensured characters wore what was typical of the character. For example, the doctor wore a lab coat and glasses, and the patients wore hospital gowns. The props used also have significance, for example, the pill which is featured in our film. This is also done in real media products, for example in Shutter Island it shows the significance of the match at the end. We decided to end our trailer with an end slate saying coming soon. This is often more common for teaser trailers as they are released much before theatrical trailers and the release date is often unknown. We also included our social media links to establish a brand across a variety of media platforms, and this is also a way of marketing our product.